Hello dear students, welcome to our today's video. In our today's video, we are going to see what is SUPAC, that is Scale Up and Post Approval Changes. So you are with me to understand the concept of SUPAC. So let's begin. So students, basically SUPAC stands for Scale Up and Post Approval Changes Guidelines. I'll explain you with an example. Imagine you are baking cookies. You follow a recipe in order to get yummy cookies. Now imagine you want to make lot more cookies using the same recipe. But when you make a big batch, you're worried that they might not turn the same as you have prepared now. Here is where SUPAC comes in. That is, SUPAC is like set of guidelines to make sure that your cookies are similar to that you had made on a smaller scale. Thus, SUPAC is like a set of guidelines in pharmaceutical world that ensures, just like the cookies, here we are talking about medicines remain safe, effective and consistent when things changes. Here the things changes like the location may change, right? For small cookies you may use your own kitchen, however on a larger scale you may need to have shop, right? So same thing for medicine. For a smaller scale you went for a pilot plant, now you may go for a firm, right? So SUPAC helps pharmaceutical makers follow rules to keep the quality of medicine unchanged, whether they are making a small batch or a big one, right? That is, the size doesn't matter whether you are making on a smaller scale or a larger scale. However, its quality should not change, it should remain constant. It's all about making sure medicine always work well and are safe for people even when the process of making them changes. So students, this assurance is quite important as a small change may affect medicine to a greater way. Therefore, SUPAC assures that it does not affect quality anyways. Moving further, aim of SUPAC. So aim of SUPAC is sameness or equivalence before and after changes. So whatever the changes may be in terms of quantity from a smaller scale to a larger scale. In terms of process, there is some modification in the process. In terms of place, okay, in terms of equipment. However, the formulation that is been prepared, they should be similar or same or equivalent, okay. That is, medicine should work the same way even after the changes are made. Then the purpose, so it guides how pharmaceutical companies should handle changes in manufacturing and production process. And at last but not least, need for SUPAC is change that can affect medicine's quality, safety and effectiveness should not happen, right? So SUPAC ensures that changes doesn't harm patient or product quality. So I hope you have understood the concept of SUPAC. Thank you very much.